Hi, I'm Dr. Doug. I'd like to talk to you today about colic and chiropractic and how we can help with that. Typically, colic is described as 3 hours or more of crying every day, 3 or more days a week, or 3 or more weeks at a time. That's classic colic. And basically what colic is your body, or your baby's body screaming for help. It's, the only way a baby knows how to tell you they're hurting is by crying and letting you know they're in discomfort. Now, not always are babies having classic colic. Sometimes they have what's called IBS, or irritable baby syndrome. And some of the symptoms of colic or IBS would be that they're not easy to console. They don't want to be picked up. There's nothing you can do as a parent. They have difficulty feeding, difficulty nursing. They don't like to feed on one side. And those are just some issues with colic that we typically see. Now, most doctors say babies are going to grow out of colic, that you can give them a drop or something typical like that. And that's not necessarily true. We don't necessarily see that. Within chiropractic, the profession as a whole has very good success with colic. As a matter of fact, 94% of all babies who go to a chiropractor have successful results with being treated for their colic. In our office personally, it's more like 98%. That's because we specialize in children. We're able to get to the cause of the problem and help these kids out. So, when it comes to colic, it's your baby is telling you that something is wrong. And your motherly or fatherly intuition, if you're going 3 weeks, you obviously know something's wrong. You know your kid's not going to grow out of it, and that something needs to be done. And truly what I'm telling you is that chiropractic is something that can help. In this office, we do get 98% successful results treating kids with colic, helping them get through that. So that's kind of a nice thing to know about chiropractic, and that we can help with that. So how in the world does chiropractic help with babies, and especially help with colic and things of that nature? I want to do just a quick review on chiropractic and what we're talking about. If you review any of our previous videos, you're going to know that we talk about neurology a lot. So I'm just going to quickly draw a couple things here to make it real simple for you so you can really understand what's going on with your child. So first we're going to start with the brain, okay? And forgive me if my drawing is crude, but we're going to get to it here. So here's the brain, and the brain controls everything in the body. The brain sends signals to all parts of your body, but it has to have a way to do that. So it uses your spinal cord. And from the spinal cord are different nerves that branch off going to all parts of your body. So this is a nerve, and it's going to go right over to your heart. Okay? And this is literally how the brain and body will work. It'll send a message from the brain down the spinal cord, out the nerve to the organ or your heart, and that organ will start to function correctly. And what's kind of interesting is that our nervous system is protected by bone. So our skull protects our brain, right? And the spinal bones are what protect the spinal cord and the nerves. And as long as the spine is in proper alignment, the messages can be sent from the brain, down the spinal cord, out the nerve to all parts of the body so the body can function correctly. When that spine gets out of alignment, it literally can block the nerve flow to the body parts, and that can cause some serious issues. So with colicky babies, if we're having issues with the stomach, we're not getting nerve flow to the stomach, we're going to have some serious issues with the stomach functioning correctly, and that's going to lead to some problems. So this is chiropractic, and this is how it works. We're just checking for the alignment of the spine to make sure everything's properly in place so that all the messages from the brain can get to the body so the body can function correctly. So some common areas of subluxations in colicky babies are going to be in the upper neck, right here, and in the mid-back, down in here. Those areas go to areas of the stomach that help with digestion. So in the upper neck, in this area, there's a nerve called the vagus nerve. And that nerve sends a signal down to the stomach and causes the stomach and upper stomach to work correctly. In the mid-back, in this area, those nerves go directly to the stomach. And a little bit lower in the mid-back, those nerves go to the small intestine and large intestine. So we got to make sure the spine's in alignment there so that these areas of the body can function properly. And these are pretty typical areas for kids, especially young guys like Roman here, to get out of alignment and causes symptoms of colic, reflux, and indigestion, constipation, things like that. So that's what we're looking for in little guys like this and little girls, to make sure that these areas of the spine are in alignment, everything's working properly. Now, a lot of people want to know, well, how would my baby get a subluxation, the misalignment of the spine in the first place? And I'll say really honestly, the birth process is not easy. As all mothers would know, it's not an easy thing. Matter of fact, my daughter had a subluxation at birth right here at the top of the neck, and that can cause some serious issues with the stomach, because there's a nerve that comes from the neck, goes down and innervates or tells the stomach what to do. That nerve is called the vagus nerve. And that nerve kind of gives innervation to the stomach and tells the stomach what to do. Also, we can have nerves that go directly to the stomach, and that can cause issues. So we're just checking for the alignment of the spine to see if there's proper signals being sent from the brain to the body, and we want to make sure that that's going on. Now, in this office, we also do something where we specialize in treating kids, and we always say we don't guess, we test. So we use specialized technology that helps us to determine where the areas of subluxations are in your children. And this technology is very gentle, doesn't hurt at all, and it really helps me to pinpoint if this is actually the problem that's going on in your child that we can help with or not. And so I'm going to go over a couple scans so you can kind of see firsthand what it looks like when we find a colicky baby that has subluxations and what our scans look like. So I'm going to explain those and give you guys kind of a good idea of what's going on there. So our first patient, as you can see on the scan, has some massive tension and heat coming off the spine in the top right side of the spine. It's really red up there. And to me, I'm really pinpointing this fact that this guy has got some serious misalignment, serious subluxation in the upper neck. Matter of fact, he has some reflux as well, inability to keep his milk down, so he's spitting up, and he's having some difficulty feeding on one side, so he's only feeding on one side. He doesn't want to turn his head the other way. These are all very typical things we see with colic, reflux, torticollis, things of that nature. And he had kind of a rough birth. He had a vacuum-assisted birth coming into the world, and so that can be some stress that would create misalignments in the spine, and that's very clear from this scan. And the parents were very relieved that we could actually found the subluxation and that he got really good results really quickly. The other scan, same kind of thing, except this one's even worse. You can see the left side's very red. He actually had a really horrible time. He was a breech position baby. His feet were over his head. In the room, we called that in utero constraint. So something was, before he was even being born, he was kind of contorted and twisted up in there, and that can create a subluxation before he was even born. And so when he came out, he instantly had latching issues, difficulty nursing, turned into some colic and reflux and things of that nature. So you can see it's kind of a combination of different things. And like I said, we don't guess, we do test, we do find these things to make sure these kids are having the right kind of condition found, and that we're able to help them out and know for sure that we're doing the right thing for them. So our solution, once we find that subluxation through scan and through our exams, we know that we can help these kids. And the only solution for a subluxation is a very specific and gentle chiropractic adjustment that realigns the bone to take the pressure off the nerve so the nerve flow can come from the brain to the body so the body can function correctly. That's as simple as chiropractic is. It's very gentle. Kids oftentimes, when they're real small, sleep right through the adjustment. If they're a little bit bigger, they think it's funny. They tend to have a good time with it. And so that's what we do. So if you know any child that's having colic, reflux, constipation, torticollis, know that we can help. We're going to find out exactly what's going on, get right to the cause, make that specific chiropractic adjustment, and help these children. So again, if you know anybody, please contact our office. We'll see if we can help them out. Thanks a lot.